talking about what outpatient care now looks like under this new system and how patients are now bearing the brunt and the lack of medical care at level 2 and 3 hospitals, because this new system is meant to, it operates in almost a utopian world where a level 2 or 3 hospital is meant to deal with, small ailments, you've sprained a leg, you have a homa, things like that. And then for larger cases that require referrals, you go to a level 4 or 5 hospitals, i.e., Moi Teaching and Referral, Kenyatta National Hospital, etc. But as we all know, a lot of these smaller hospitals, level 2 and 3 health centers and dispensaries, sometimes don't have the capacity. They also don't have digitized records to be able to refer people onwards to get more specialized care. So who's bearing the brunt of this? Of course, it's the patients. Now, the sick are bearing the brunt of this rigidity. At lower level hospitals where access to outpatient care is limited, they have fewer drugs and equipment, and they face major staff shortages. When the SHA law was passed, it introduced the Primary Healthcare Act, which structured the provision of primary healthcare, which is normally accessed at community levels and dispensaries or health centers. That's level 1, 2, and 3. Of course, this provides funding for level 2 and 3 hospitals for that specific purpose. But as I've told you, the hurdles are there in plenty, including the lack of digitization of records, the staff shortages, the lack of drugs, and much, much more. The hospitals also lack diagnostic tools and specialized kits, further complicating treatment. For many Kenyans, the shift to low-level hospitals has created unnecessary hardships. Now, while the idea is, rooted in something that's very practical, that for small ailments, you can go to a community health center, a dispensary, etc., and then for more serious ailments, you go to a referral hospital where you can, of course, take the burden of them treating smaller things. That only works in a world where they do have the capacity to treat even the smaller things, and that's definitely not the case. Now, this is a few people spoke to the Daily Nation and said that if we had proper patient registry, their history would have been captured by the SHA portal, which would then allow them to be treated and seen at level 4 hospitals. It's only at higher levels that their conditions are managed. That's according to Dr. Lishenga, who was speaking to the nation. He says, we did not prepare hospitals for the transition. A majority of them are not even run as hospitals. And now we are mandating that patients must be treated with no proper referral system, which of course is extremely dangerous for the health of these individuals and the overall health of the nation. Let us know what you think of this story on the hashtag Morning Fix.